Well, welcome Marc Wathelet to this interview in which we're going to discuss your astonishing, really unbelievable proposal that following a plan that you've laid out, the pandemic could be ended in your own country, Belgium, or in Australia here, in something like 6 weeks. So Marc, what on earth, what are your credentials that you could possibly make such a proposal?
I'm a chemist by training. Then I did a PhD in molecular biology. And the topic of it was to understand at the molecular level the response of human cells to a viral infection and to a very powerful cytokine with antiviral activity that's called interferon. And after that, I went to the US to do what's called a postdoc. And I worked at Harvard University for almost 10 years, where I continued that research. After that, I got a faculty position in the College of Medicine at the University of Cincinnati. I had my own lab there, and I continued my research. And then in 2003, that new virus emerged from China, a coronavirus called SARS-CoV. And I decided to devote the efforts of my lab to researching that particular virus to try to understand how it was causing diseases.
Now, more recently, I think at the beginning of the year, more or less, you wrote this letter to the Prime Minister. We're talking about Belgium, by the way. You wrote the letter to the Prime Minister saying that you had a plan to end the pandemic in 6 weeks. I think we should get to this plan. Now, of course, the audience is going to be so skeptical. How could there possibly be an end to this mess we're in 6 weeks? But so anyway, please share with us your idea.
So I first need to explain how you normally control an epidemic or pandemic, right? And so it's textbook epidemiology. Now, basically 4 pillars that you need to rely on in order to control the pandemic. The first one is that you have to prevent as many cases as possible. And it's possible to do that if you have a good testing and tracing system in place like the Chinese do. And if you are very effective with that, you can drastically reduce the number of cases. But in Belgium, the tracing and the testing were abysmal, and so that was not an option. The second thing you need to do is to do early treatment. Early treatment is key for any disease. And so it's one of the absurdity of the situation with this virus is that basically in Western Europe, early treatments were forbidden for no good reason. So early treatment is the second pillar. The third pillar is treatment of severe cases, the one that get hospitalized. And then the fourth one is vaccination. So you need all 4 pillars to control the pandemic.
Okay, so given the 4 pillars, what do you propose, for instance, Australia would do or Belgium would do?
Right, so for the first 3 pillars, you can solve them all if you happen to have a molecule that is an effective medication. And there's the same drawback as for vaccination, that it takes time to identify and then develop a new antiviral against this disease. However, there's another route that is recommended in an emergency situation is to repurpose existing drugs. The advantage of doing that is that existing drugs, their safety profile is very well known. So even if you find a drug that is only moderately effective against the disease, because it has a safety profile that is well known, the risk-benefit ratio is always going to be favorable. The drug is safe and it helps, so then it can be used.
Okay, so I understand it makes perfect sense to use repurposed drugs because they're proven safe. So what drug did you choose to tell the minister about as the candidate for this job?
Right, so there's ivermectin, that's the drug in question. It's a very, very safe drug. It's on the list of essential medicine from the WHO, and it has been used for decades to treat various parasitoses, especially river blindness, which is a very severe disease in Africa. And so it was known that it was an antiviral, And there's the group at Monash University, the published a paper by Kelly and co-workers showing that it was active in vitro. So in vitro, it doesn't mean too much because many drugs are active in vitro, and what matters is that it works in the patient. But a number of doctors in countries where this drug is routinely used to treat these parasitosis start using it just like they tried to many different drugs to see what works. And they found out that ivermectin works. So they start using it more and more. They start to do studies to demonstrate its efficacy, and they were working. And so on top of that, there's a really interesting story. Already in March of 2020, there was an infestation of scabies in a nursing home. And so the doctor, there was one infected resident, so decided to treat all the residents and all the staff with ivermectin. That's the standard way to deal with this kind of outbreak. And they couldn't help but notice that that particular nursing home had very, very few cases and very mild cases of COVID, while all the surrounding nursing homes had over 20% of residents being infected, and of those, a quarter of them were dying.
So there was no intention to actually be treating the virus. It just happened by chance.
Exactly, serendipity. And so he actually notified the French government, and a study was started, and then it was nipped in the bud. They decided they didn't want to do that.
Tell me, it's a bit reminiscent for me of the fact that some people noticed that in Africa, countries that traditionally took ivermectin for other things like river blindness, that those countries had lower rates of infection for the virus. So that's the same sort of thing, isn't it, really? Yeah.
Yeah.
Okay, so there was that study in the nursing home. They didn't take any notice of it. So what next with your plan?
Right. So, the Belgian government was putting in place measures that were guaranteed not to work. So we were sure to get a second wave. I predicted it, and it came, and it was worse than the first one. And so then I was looking at all these studies that were coming out indicating that ivermectin was effective in prophylaxis, in early treatment, and even for severe cases. And so, these studies were coming up, but they're coming from third world countries. So you understand that people in the Western world might be a little bit skeptical. But when there were enough studies, I decided to write to the Prime Minister and then explain that, in the case of an epidemic, if it's basic epidemiology, if you have a drug that is effective in prophylaxis, that's the key part, then you can completely crush the reproduction number of the virus, which is the average number of people infected by one contaminated person. So if it's above 1, the virus is going to spread to the community in an exponential fashion. But if you can bring it below 1, then the epidemic is over. And so that's what ivermectin does. It's 88% effective in prophylaxis. And so that's enough to crush that reproduction number. And so the epidemic is over if you use it, if you use it properly. And what is the way to use it is that whenever you identify a person who is contaminated with the virus, you, of course, treat that person with ivermectin. But in addition to that, and that's the key part, you treat all preventively, prophylaxis, all the contacts, the daily contacts of that person, which means the people living under the same roof, the co-workers, or the classmates, if it's a kid. And when you do that, the epidemic will be done in just a few weeks.
Okay, so what dose would we be looking at, Marc?
So for the person who is infected and is symptomatic, you give them 24 milligrams per day for at least 4 days, and you continue the treatment for an additional 2 days after the end of the symptoms to prevent what's called long COVID. And for the contact of that person, you give them, for an adult, 18 milligrams per adult in 2 doses on day 1 and on day 3.
And for children?
For children, you adapt the dose based on the body weight.
Then I suppose that after some short period, you have to test all these people again, don't you?
Yeah, you can test all the contacts and of course the infected person let's say 4 days after the first case, and see if any of them have developed a viral load. And then you can take further measure according to the results.
Right, to reassure everyone that you're on the right track.
Exactly, yeah.
So now, why did you choose 6 weeks?
It's just, why did I choose a 6? So the time, okay, so let me think. The time it takes for the virus to be transmitted is 5 days. And then there's 5 days incubation period. So you count about 10 days for a transmission. So when you do that, and you say 3 weeks, sorry, 6 weeks, that's 3 periods, okay, of transmission. So, so in 3 periods, if at each period you reduce the transmission by 90%, you get very quickly to 0, right? So that's kind of what was in my mind when I came up with 6. And doesn't mean that you won't have a few cases here and there, but as long as you keep applying the plan, you can completely return to a normal life.
Like if the Australians are going to be totally nervous and disbelieving about all of this, so they're going to have to build confidence amongst themselves and the public that this is a good path.
Okay, so you know, I know you have mentioned that a number of times. You build confidence, but you don't build confidence it just doesn't work this way. If you have a plan, you need to apply it full steam. That's it, right? And so the key for that is that the drug is completely safe. So there's really no risk. Now, if you want to first do in Sydney or in Queensland, well, then you just do it there. But why wait?
Well, what if it doesn't work?
It's going to work because we have the example of these countries, India, Slovakia, who have used it, and it works. The number of the cases in these countries came crashing down when they start using the drug. So we know that it works. And early treatment has always been key to control any kind of pandemic. It's the second pillar that is needed to control a pandemic. And now even in the US, Dr. Fauci has insisted that we need early treatment. So, if even the Americans are recognizing the importance of that early treatment.
So they're coming round belatedly to the general concept, but they haven't embraced ivermectin, have they?
That's right, they haven't. Even though when Dr. Fauci described the ideal drug, is in fact describing exactly ivermectin. You want something that is cheap, that is used early on, and that is effective, and that's exactly what ivermectin is. Everybody can go on Worldometers. It's a website where they can look at every country, and they can see the number of cases and the number of deaths, and they can verify with their own eyes that it's indeed the case.
Right. Now, our aim here is to drive vaccination up to 70% with the hopes that this will be a game-changing position. But if we look at Israel, this graph here, and then this graph of Iceland.
And in Iceland, it's people over 16, they are 93% vaccinated. So it's an extremely high rate of vaccination. And unfortunately, this is not enough to prevent the emergence of new cases. And again, I will cite Dr. Fauci in the US, who explains that with the more contagious variant, that's the Delta variant, there's no difference in the viral load of people who are vaccinated or not vaccinated. And so unfortunately, the vaccines are not efficient enough to prevent infection and to prevent transmission of the virus with these more contagious variants.
That could be where we're heading, those two graphs, Israel and Iceland, if we rely only on vaccination.
Yeah, you really cannot rely only on vaccination. It's very well known in epidemiology that vaccination is the fourth pillar, and you cannot just rely on it. You need to have the prevention, and then you need treatment of the severe cases. If you only use vaccination, you will absolutely not control the pandemic. It's absolutely clear.
But we have put all our eggs in the vaccination basket. I'm just wondering how our health officials will ever be able to. I know that you should say they have to, but how do they come to this? Is there some way of dipping their toe in the water?
I guess the Australian official have just to look abroad a little bit and see if Dr. Fauci in the US is saying that vaccination is not enough and that you need early treatment. Maybe they can take a page from his book.
Could also a way to dip a toe in the water just to free doctors up so that they can prescribe this medicine to their patients?
You're absolutely right. And it's the experience of all the doctors that I know that once they start using ivermectin, they found that it worked. I mean, in Latin America, that's how it started. The doctors just found that it was working. And so they tried different drugs and they continue with the one that seems to be working, and then they have a lot of success that way. And in Belgium, it's the same. I know a number of doctors that start using it, and they say, well, we have heard some report from Australia that it might be useful, so they use it. And they noticed that it was very helpful, that the patients who were like really sick within 48 hours were back on their feet. And so, of course, they keep using it.
I find that so ironic that we in Australia actually kick-started this thing, because the Monash University studies more than a year ago showed that ivermectin worked in vitro in the lab. And within 48 hours, I read there were doctors in other parts of the world who'd read about this and were already starting to use it. And apart from Dr. Tom Borody here, who was using it very quickly and effectively, but he wasn't listened to at all, we really dropped the ball.
The whole Western world dropped the ball in this pandemic. It's very clear.